Namaste and a very warm welcome to our distinguished guest, Dr. Colonel Amit Garg, a defense veteran and academic visionary.
Right.
Our respected moderator for this session, Dr. Geeta Potarajuji.
Right.
Esteemed presenters, Dr. V. Sathyanarayanan and Dr. Gopal Babu, and participants from across the globe in the institutional sharing session of the 10th International Conference on Human Values in Higher Education. Today is day 3 of this conference, and we continue our collective journey of reflection, dialogue, and learning towards empowering youth through value-driven education. My name is Neetu Chauhan, and I serve as a faculty member in the Department of Electronics and Communication Engineering at Manav Rachna University, Faridabad. It is my privilege to extend a heartfelt welcome to today's esteemed guests, presenters, and panelists, and all the attendees. It is my privilege now to introduce our moderator of the session, Dr. Geeta Pottaraju. She is an associate professor at the Institute of Public Enterprise, Hyderabad. Ma'am completed her PhD in management from Department of Business Management, Osmania University, Hyderabad. She has over 25 years of research, teaching, and training and development expertise. Her areas of specialization include public sector reforms, participatory governance, performance management in government, and health system strengthening. She has done many assignments with Government of India, various state governments, international donor agencies, and others, and also worked in South Asia with governments in Sri Lanka, Bangladesh, Bhutan, and Nepal. Dr. Geeta has been associated with the UHV since 2022 and actively volunteering for various activities and projects related to human values in higher education. Her sustained journey of self-exploration has significantly influenced her worldview, values, and life purpose. We are honored to have her with us today, and I warmly invite her to guide us through the session. Over to you, ma'am.
Thank you so much, Dr. Neetu, for such a generous introduction. Thank you very much. So again, I will invite all the three very, very important panelists.
Geeta Didi?
With us. So I will very briefly introduce our guest before I go into the main session. So Dr. Garg is a defense veteran and an academic visionary, and he serves as a Director General at the Gateway Education at New Delhi. He has over 30 years of experience in the Indian Army, especially in the electronic and mechanical engineering area. He is a BTech, MTech, and PhD from IIT Delhi. He's a perfect blend of a practitioner and an academician. I think there is so much to learn from his words of wisdom today, because I think this is a time when this knowledge is, I think, most vital for us, especially in the current times. Thank you very much, Dr. Garg, for being with us and being with us as an esteemed guest.
Thank you, ma'am.
So now let me move on to, thank you very much, sir. I will now introduce the two very special panelists we have. Dr. Gopal Babuji from Ajay Kumar Garg Engineering College. And Dr. V. Sathyanarayanan. And Dr. V. Sathyanarayanan from ASRM Medical College. So I will introduce the first panelist today, the first presenter, Dr. Gopal Babuji. Dr. Gopal Babu.
Namaste, Didi. Namaste, everyone.
Namaste. Namaste, Dr. Gopal. I'll briefly introduce Dr. Gopal Babu and give the floor to him for his presentation. So, Dr. Gopal Babu is a faculty member at the Ajay Kumar Garg Engineering College, and he will be the first panelist with us, and he's going to share with us on reaching UHV to faculty, staff, and students, and how it is impacting the culture of our institution. So he's basically an institution builder, and this is a very important discussion that we are going to have. Dr. Gopal Babu is a BTech, MTech PhD from IIT Delhi. His research work is very important and very intensive. He has worked on studying the inherent harmony and coexistence in nature for evaluating sustainable socio-technological systems. He is a lead mentor of our UHV core team and has been conducting extensive workshops on human values and professional ethics for students, for teachers since 2010. For all our participants who have joined through different modes, I would like to tell you that this is a rare opportunity we all have, especially the academic community and others who are looking at the possibility of creating a value-based culture in their respective institutions. I'm sure Dr. Gopal Babu's sharing will show us the way forward in this direction. So, Dr. Gopal Babu, we have planned the session in this way, 20 minutes for your presentation and 20 minutes for question answers. So the floor is yours, sir.
Thank you very much, Geeta ji. So I am glad to have an opportunity to share how UHV is impacting our institute, how culture is shaping with the effort of UHV. So let me share my slides. I hope my slides are visible, Didi.
Yes, yes.
Okay.
Yes.
So today I am going to present how we are reaching to faculty, staff, students, and how it is impacting sanskar and culture of the institutes. So I am from Ajay Kumar Garg Engineering College. So let's have a brief glance of AKGC. It is established in 1998, approved by AICT, affiliated to Dr. APJ Abdul Kalam Technical University. We have 12 BTech branches, 4 MTech, MC and MBA, accredited by NAC A++ and MBA in 5 programs. QS Gauge with diamond rating and excellent infrastructure and state-of-art labs. So with this brief introduction, I am moving towards how UHV is working in our institutes. So basically in AKGC, academics, skills and values all are blended, growing together. So in this presentation, I am going to discuss the policies that are helping the whole institute to evolve as a UHV-based culture. And I will also give a brief presentation on how we are expanding as a regional older center and what extensive efforts we are making to reach to our students. Because it is easy to start UHV courses, but actually at ground level, how can we reach to students so that they can live in an ethical manner? So that I am going to present here. So basically, I am going to present how we are impacting individual sanskar and collectively how this sanskar is creating a culture, UHV-based culture. So if we see UHV at AKGC, we are committed to prepare life-ready graduates. We are reinforcing values in leaders, faculty members. We are empowering staff. We are expanding this UHV as a regional order center, and we are serving society through various means. So let's have a brief journey on value education cell of AKGC. So in 2009, AKTU introduced a mandatory UHV course and organized a UHV conference for all its affiliated institutes. And an audit course was started in 2009 in each affiliated institute of AKTU. So in AKGC also. But in 2017, the college established a value education cell. And the cell was not only established, we worked hard on value education, and gradually it became visible everywhere. So in 2019, university declared us as a regional nodal center. Then in 2024, we got membership of United Nations Academic Impact. We started working on SDGs. In 2025, we got certificate of recognition for voluntary and transformative contribution to UHV in education by the UHV Foundation, New Delhi. Then we signed national and international MOUs. One MOU is signed with RKG ITM Ghaziabad. Another MOU we signed with YD of Bhutan. Then recently we got Institute of Happiness Award by QS iGauge. And most recently, AICT declared AKGC as a regional nodal center. So this is a overall journey that we made during the years. Now AKGC vision is not to only teach students, not to skill our students. AKGC vision is to make AKGC as a Gurukul, where students are learning skills and living with values. So such kind of vision AKGC has, and we are working on this. So let me give you a brief review on the policies level. So there are many policies at central level that is helping us to ensure a UHV based environment. So for example, UHV sessions for deans and HODs twice a month. So in our college, we shall conduct UHV sessions for deans, professors, HODs twice a month. So this content keep motivating everyone, starting from bottom to top leaders. Then in our college, UHV2 is mandatory for all faculty members. So to close their probation period, they need to have UHV2 certificate. And the college also gives incentives for those faculty members who attend higher level FTPs. So college gives 10,000 rupees cash if faculty member attends UHV3, UHV4. And due to these policies, we are running 2 consecutive lectures in UHV classes. So this time is required so that we can start process of self-exploration in students. So this course is not like that we are finishing the syllabus. The purpose of this course is to initiate the process of self-exploration in students. So the classes is run in dialogue form. So we need enough time to run the classes. So that's why this policy is made by our authority. Then those teachers who are teaching second year, third year, and final year, we conduct weekly meetings with them every 2:30 to 4. So 3 weekly meetings we conduct with those teachers who are teaching UHV so that they get the strength of the concepts, so that they can communicate the real essence of the content to students. Similarly, department level UHV seminars. So along with the research seminars, each department conduct UHV seminar in the presence of head of department. So all we cell member monitor, observe those seminars, make a report and submit to higher authority. So such kind of policies are helping us to make a UHV based culture, UHV based motivation, UHV based living in the campus. So we are running FDPs for faculty members, UHV2, UHV3, UHV4. Along with this, as a regional rural center, we run UHV programs for schools. So we conducted 3-day teachers orientation program where around 13 to 15 schools participated. We also run programs for jail inmates. Last year, we ran the program for Dasna jail. Then we run UHV workshop for CBI Academy. So they have introduced this model in their training program. So we provide resource person to them. We participate nationally. We have a good team of resource person in AKGC. and they participate nationally. They conduct workshops, FDPs. This is our team. So our Director General is Chairperson, VESL. He's a member of NCUHV, member Board of Studies and Central Admissions, Board at AKTU. So this team together work for UHV and day and night. So there is a good team of resource persons at AKGC. So we work for students, for faculty members, for staff, for community, and to national level. So as I said that introducing course is not enough. So though we are running courses, UHV 1, 2, 3, 4, 5, in all the years of BTech, UHV courses are offered to students, but these are not enough. What extra effort we are making for students that I would like to present here. So in addition to these courses, we found some common issues in students. For example, lack of self-awareness. So we found that self-awareness is somehow students are losing. Then ability to counsel oneself. They are not able to counsel themselves. Once they get hurt, they keep it moving inside day and night for 1 month, 2 months. They are not able to counsel themselves. Ability to handle relationships, peer pressure. They are not able to tackle inside reaction. They are not able to work in teams. So these are the common observations that we observed during that time. So in addition to the courses, we made a specific program to handle such kind of issues. For example, we ran a workshop, a 36-hour workshops on consciousness engineering. So it is very impactful workshop. So in this workshop, a student get the process of self-exploration. A student get the process of looking inside, and gradually they are able to counsel themselves. They are able to come out of their internal suffering. So such kind of outcomes are coming in students due to this workshop. And we run this workshop 2 times in a semester. And interestingly, we run off the time. So from Saturday from 9 to 6 p.m., Sunday 9 to 6 p.m., Monday to Friday 4:30 to 6:30 p.m., and again next Saturday 9 to 6 p.m. So this is a long workshop, and students sit, they complete the course with 100% attendance, and there are many positive results of this workshop. And the impact of this workshop is that students are referring to students. Now students are referring to their sibling, go to attend the workshop. So such kind of impact is visible on our student. We also run program on understanding science of relationships, where we talk of only the relationship part, how to ensure trust in continuity, how to ensure respect in continuity. What should we do when I feel hurt? How can I ensure trust in that situation too? So such kind of workshop we will run for students. Another event we run is a Drashti. It is a video-based event. We show a video to students, then students share their perspective. Then our VSL members share their perspective from UHV point of view. And it impacts the perspective of students. And students are able to see that they are not able to sense the movie with UHV perspective. So such kind of event trigger students. Then we conduct workshop on mutually fulfilling communication. It is again a very important workshops. Many students complain that they are not able to express their feeling. They are not able to listen others properly. So we have made this module to such kind of students. And after this workshop, students are able to see the progress. They are now able to communicate their feeling to their parents also. So gap between parents and students, friends and other friends, it is reducing day by day. So such kind of impacts are coming. And we have also a workshop on soap making workshop. We provide raw material to students. We train our students to make their own soap. And these soaps are very natural. The tree which are available around the campus, we use those leaves and make a tray. So students are very happy to see that they are making their own soap naturally and organically. We have started the event Samriddhi Prabha, where faculty members, students, everyone share the extra resources with others. So anything, if you have books, if you have clothes, if you have electronics item, you can share with the others. So this is not the donation camp. This is the resource sharing camp. So if students gives something, if I think it is usable for me, I can also take it. So it is not like we are donating to poor people. We are sharing extra resources with each other. So it is creating a culture of sharing in college. Then we invite guests from outside to have their perspective also. We conduct workshops for our staff. We conduct workshop for family members of faculty members. So faculty members come along with their child, their grandparents, and combinedly we conduct workshop for them. Now, this is the brief description of the activity. Any other time I will give you more detailed description of these activities. But now I am going to present how these activities are impacting the sanskar of individual. That I am going to present. So this is Arun Kumar Maurya. When he joined the first year, he stammered. He was not able to speak fluently. So when he joined the course in first year, conscious engineering course, then we sent him to IIT Kanpur for 8 days workshop. Gradually, he got inclination towards human values. And the person who was not able to speak fluently till 4th year, he was able to overcome this deficiency. And now he speaks very well. And not only speaks very well, but also he got silver medal in AKTU, and in MTech he got Chancellor Gold Medal. And he gives all credit to value education courses. So he was involved from first year to final year. Then he recommended his junior, Devansh Bhatnagar. So he was his junior. So he recommended Devansh that you join VSL from first year, you do all the courses, and Devansh follows him. And when Devansh followed him, so at the last he got bronze medal from AKTU, and he was from batch of 17 to 21. So such kind of culture is being developed. Students are referring to students. Then another student, Vandit Mishra, he with his sister, with his 2 friends, all together they joined the workshops, all the activities of conscious learning, all the activities of value education cell. And now he has got silver medal from AKTU. So such kind of impact are coming. Why they are getting these medals? Because they share that they are now more focused. They are less diverted from environment. They are able to plan their curriculum, their course. So such kind of focused outcome are coming in our institute. Then this is, she is Sai Nancy, BTech 3rd year student. So it is very interesting case study for us. So she joined the college. She is a sports person, and suddenly don't know what has happened with her. Soon she started self-doubting. She was surrounded by anxiety. She started overthinking. And she reached to the point where she thought of leaving everything. Even her parents came to withdrawal from BTech. But the moment he joined at this conscious engineering workshop, 36-hour conscious engineering workshop, then she took U-turn. Now she is more focused, more enthusiastic in sports. And last time she won the zonal and state medal. And it's a 2-time state winner, 2024 and 25. So people who are going through these activities, in addition to UHV courses, they are getting more and more focused, more and more determined, whatever they are doing. So such kind of impact are visible in many students in our college. She is Kirti Gupta. Again, she is the case like Sai Nancy. Once a time, she thought to leave the college. Her parents came. Her luggage was packed, but she thought to attend conscious engineering workshop one time. So the moment she attended the workshop, she changed her thought. She thought, no, I can do BTech, MCA. Sorry, she's from MCA, and she did MCA, and now she is doing job in a company in Noida. So this kind of sanskar we are able to see in our engineering students. So now I will give a brief presentation on culture, how the collective culture of college is emerging. So 3 categories of faculty member, the impact wise. So highly receptive, few faculty members are highly receptive. They receive UHV concept very quickly. And these receptivity are visible in their changes also. Some faculty members, they are partially receptive, they understand, discuss, but they feel struggle to apply them fully. And few faculty members are low receptive, initially indifferent, but still absorb some content. Changes appear gradually. So if we see, we can see that impact reaches to everyone, depth varies, but direction is positive that we are able to see. So what kind of cultural shifts are happening in AKGC that I am going to present? So I will take 5 to 6 minutes more with permission of Geeta ji. Right. So first point is increase in self-reflection and self-correction. So it has become common in AKGC faculty because mostly faculty have done UHV 2 FDP, then UHV 3 FDP. For a long time, people are attending FDPs and participating in VSAR activities. So whenever they speak, whenever they feel contradiction in themselves, this question is very normal. So faculty ask, is this my ego speaking or is this my natural acceptance? So this question has become very common in everyone. So whenever they are thinking something, they ask this question. So it is happening very commonly in our college. Then strengthening of role model faculty clusters. So few faculty members, 15 to 20% faculty members have become role model for others. So even at faculty level, if there is a problem, those faculty member reaches to these 15 to 20% faculty members and they ask for the solution because they believe that these person will give holistic solution. These people are very patient. So they will give a holistic solution. So everyone reaches to those faculty members. So this cluster exists at AKGC. Emotional digestion. This is again a very important culture coming out. So faculty are slowly developing the ability to absorb difficult situation without reaction. So whenever there is a contradictory state or contradictory interaction, immediately they digest their reaction. So digestion of this reaction is creating empathy for others. So this is happening in our faculty members. Similarly, increased sense of personal responsibility. So faculty now has recognized that I cannot change the other person immediately, but I can manage myself immediately. This has appeared as a common factor in faculty members. So initially faculty used to think that I will change other faculty members, but now this shift has happened. Now faculty think that I can manage myself immediately rather than change the other person. Then normalization of UHV language in departments. So it has become very common. Words like reflection, awareness, intention, natural acceptance, harmony, coexistence, relationships, responsibility, right evaluation, human consciousness, animal consciousness, these words are very common in general talk. So even faculty member, when they speak with the students, they use the same terminology that we using in UHV workshop. So terminology wise, we have become common. So students listen the same terminology from me, same terminology from their technical faculty members also. So this has become a common culture. Faster emotional recovery. So conflicts that earlier lasted days now resolve in hours or minutes. It indicates improved institutional emotional climate and conflict management norms. That's why we have got IOH Award, Institute of Happiness Award. So now faculty members are able to counsel themselves. They easily come out of their conflicting states. So it is also happening very commonly. Then integration of values in pedagogy and assessment. So whenever faculty members are teaching, they are using values. So teaching culture is broadening from technical delivery to include guidance, reflection, and value orientation. Faculty increasingly assess projects for social relevance and incorporate UHV language in teaching. So this UHV language is coming into the teaching pattern of the faculty member. In fact, those faculty members who are very technical, but when they teach UHV, they found their student very receptive because they are also learning UHV from the same faculty members. So receptivity of a student has improved. Shift from collective punishment to individualized handling. So this again is a common factor. Rather than giving punishment to whole class, now faculty are able to handle the individual students. Less leg pulling and negative talk. So this again an important factor for any organization. So earlier people used to do leg pulling, negative talk about the system, about the head, etc., etc. But now faculty members have observed that they are talking solution oriented rather than problem oriented. Better counseling culture. So again, those faculty members who are very inclined towards UHV, those who have got concept very well, they have become counselor. Even it is happening in students also. Those students who are involved in UHV with VSL, they have become counselor. They are counseling their juniors. They are counseling other friends. Even their family members reaches to those students. Then this is the problem. Tell me the solution. So such kind of things are coming. Spiritual clarity. It is again an important factor. So earlier when faculty member used to see any quote in temple or any other places, now they are able to understand those quote very clearly. What is the real meaning of those quote? People now after UHV courses, when they listen Gita, when they listen their scripture, they get clear meaning of those scriptures. And lastly, students show more acceptance of correction. So when technical and UHV subjects are being taught by the same faculty member, students are in the mode of corrective, self-corrective mode. So they correct themselves rather than arguing with others. So lastly, together we can contribute to a happier, healthier, and more harmonious society. And we truly believe this collaboration will be naturally enriching, and we look forward to walking this journey with you. Thank you very much. That's all from my side.
Folded hands. Thank you very much, Dr. Gopal Babu. I think I've heard all these days about hands-on industry experience, but I think this was hands-on happiness and prosperity experience. I can't thank you. And there are so many messages coming, and I think so many people would like to talk to you and ask you. So should we, Neetuji, I think we will give 15 minutes window for question answers if there are any.
Ji, Didi. Yes.
There's a professor who has yes, 1 minute. Yeah, Professor Datta. Professor Datta, you have been given the mic. If you can unmute yourself and ask the question. Professor Datta, K.R. Datta. Yes, go ahead, sir. No, I think we have another professor who has. Okay, sir, go ahead, sir. Ask the question.
Good afternoon, sir.
Good afternoon, sir.
I'm audible, sir.
Yes, sir. You are clearly audible.
Thank you. Thank you, ma'am. Thank you for giving this wonderful opportunity, sir. Sir, you are giving very good initiation for this universal human values. We definitely change the world, sir. Your initiations are very, very good, sir. Superb. I really impressed, sir. I want to connect with you, sir. Please give me your contact number. Why? Because I am in our institution. I am working in Tamil Nadu, Nagapattinam, sir. EGS Pillai Engineering College. My college now within 6 months before only we established the UHV cell, sir. I need your contact number. I am so impressed for your initiation, sir.
Yes, sir. So together we can do whatever we are doing. So,
Okay, sir.
So definitely I will help you whatever I can do for you, sir.
Okay, sir. Okay, sir.
And already in Tamil Nadu, Chennai, this UHV work is going on.
Yes, sir.
UHV FDPs is going on. Have you attended any UHV FDP, Bhaiya?
Yes, sir.
Okay, so it is good. Are you attending morning session also?
No, not yet, sir. Upcoming session, I am plan to attend the sessions, sir.
Sure, sir. So you will get my number from volunteers, Bhaiya.
Sure, sir. Sure.
Yes.
We will pass it.
So thank you
Okay.
very much, Bhaiya.
Thank you, sir. Thank you, sir.
Yes.
Thank you very much, sir.
Thank you, ma'am.
We had another Professor Datta. He's not there with us now. Anybody else who would like to ask a question to Dr. Gopal Babuji? You may kindly raise your hand and the mic will be provided to you. Yes, Professor Sanjay. Professor Sanjay. Yes, Professor Sanjay, please go ahead.
Hello, am I
Yes.
audible?
Yes, sir.
Yes,
Yes,
sir.
sir.
नमस्कार गोपाल बाबू सर।
नमस्ते सर, नमस्ते।
नमस्ते। हाय, आप तो पूरी दुनिया चेंज करने वाले हैं। मुझे तो तुम्हारा कॉलेज तो क्या तुम्हारे लिए बहुत इजी है। आप तो पूरे सभी मॉर्निंग सेशन में मैं देखता हूँ। आई एम सीइंग दैट यू आर चेंजिंग द सो मेनी पीपल्स, so many institutes, professors and all these other. You are also taking the UHV sessions for the judge peoples, those who are actually taking the actions. And this is a very good initiative. I feel that you also start to the politician. If it is started to the politician, it will percolated faster. It is not problem, but it will be percolated faster, I think. This is my what I required. It's really a great. Thank you, sir.
Yes, sir. True, sir. So this expansion of UHV is required everywhere in
Yeah.
every stream. So, but we have started with students, with faculty members. Now you join us. You can start with politicians, or be together.
Yeah.
And spread
Yes,
the
yes, definitely, definitely.
Yes.
Thank you,
very much.
thank you, sir.
Thank you, Sanjay ji. We have Ajay Kumar Palji also, I think, who has raised his hand. Ajay ji, you would like to
Ji.
ask something? Yeah.
Yes, yes. Very nice presentation by Gopal Babuji. And as a faculty, my question is that as a faculty, I also wanted to contribute like this in our institution. But at times, when system does not support, है ना, or the environment of the college does not support, then that zeal to make contribution for the betterment of education, sometimes I feel low and unable to take initiatives at institution level, at my own institution level. So if some guidance can be there from him, that how some initiatives can be taken, how to make collaborations with the other faculty members and start some initiatives. So I need some guidance on that from Dr. Gopal Babuji.
Ji. So problem is not that your institute is not supporting. Problem is you are feeling low. So this is the main problem. So what we can do here, so in my previous college also, when system was not supporting, I started taking workshop of student in evening. So no system is stopping you to invest your time with students and work for them. So I started working with students in the evening, and when students' performance get better, then they came into notice of the management or higher authority. So you start with students, you start with your colleagues. So if you start in this two dimension, so gradually the whole institute will welcome you to do this work at institute level. So initially it takes efforts, initially it takes time, but gradually people recognize it. So it is not that from day one from day one the whole policy was initiated. From day one I started working with students. Then gradually students started calling other students. Then gradually we become the focus of the management, how they are working with students, how these students are getting transformed. So when they felt motivated, they joined the workshop, then they made the policy. So this is a long journey, but we can start where we are. So we can start with students, we can start with our colleagues.
Ji. Rightly said, Bhaiya, as sometimes I got attached with the outcome. So when outcome does not come by making some efforts of 6 months or 3 months, then I understand this thing that this is my attachment to the outcome. And so if I do efforts consistently, then sooner or later they will cultivate results. And yes, thank you so much.
Thank you very much, Dr. Gopal Babuji. We have another hand raised, Dr. Prabhudev. Dr. Prabhudev, you have been given the mic. Can you unmute kindly and ask the question?
Yes, madam. Good afternoon. Namaste to all.
Namaste, sir. Namaste.
Yes, sir. I have a similar issue as like the previous raised one. In my institute, in our state, mostly in our part, I thought of attending this UHV 1, UHV 2 1 week programs organized by this AICTE. But every time when I apply for the permission and approval from my head office, they are not giving it. This is the almost around 3 times I applied, but they have not permitted me to attend. Even then, with my own efforts and contact, I could able to arrange sessions for our students during student induction program and other programs. Even from getting the collaboration from Brahma Kumari Samaja and other people who are involved in this kind of things, universal human values, Vishwamanava Maulyagalu. So, and I started one universal human values cell. That is also, conducting meeting and doing something at our institute level. But what I feel, this should be made compulsory, like in giving that, while giving the, annual approval to institutions, technical institution, maybe polytechnic, engineering or degree or any institution. The apex body for them is AICTE or UGC or any other regulating body. They should make it mandatory that such kind of things should be introduced. Actually, these are the programs, the head of the department, the head of the office should conduct, organize for the faculty. Even though I am requesting.
Sorry to interrupt you, Dr. Prabhudev ji. I am extremely sorry. I know this is a very, very interesting conversation, but can you just focus on the question that you would like to ask Dr. Gopal Babu, because he might not have.
The question is like, why this has been neglected by the higher authorities? Even they know this. This is one of the most important part of our human life, universal human values. Because in our state, we have a poet named, a very famous poet, Kuvempu, Kuppalli Venkatappa Puttappa, whose birthday will be celebrated on 29th of this month, end of this month. So usually it is celebrated as Vishwa Manava Dinacharane. So based upon these universal human values only. Even though people know everything, why they make they will not mobilize kind of. So this is my question.
Where are you from, sir? Where are you from?
I am from Government Polytechnic Afzalpur, District Kalburgi, Karnataka state.
Oh, Karnataka. Okay, so though AICT's has made this induction program mandatory, so is induction program going
During
on
the
in
induction
hospital?
program, there will be session for the students. So for every 20 students, there should be one faculty to be trained by the AICT program. So that is not happening, what I feel.
Okay. Okay, sir. So no problem, sir. I hope they will realize soon that UHV is not only mandatory, it is a part of life.
Yeah, part of life, then they should understand, and they are not permitting me to attend. Nobody likes to attend because everyone wants to have a shortcut, because the training program what they conduct is right from morning 9:30 to 5:30, almost around 7 to 8 hours without break, half an hour break or a 1 hour break.
Thank
So
you,
in
Doctor.
such situation,
Thank
if
you,
someone
sir.
desires to get the knowledge in universal human values, these people are not allowing the faculties, and even
Yeah.
they want
Sir,
the next generation
Professor,
to be inhuman.
Professor Prabhudev ji, thank you so much.
Boliye, madam,
for,
boliye.
yeah, thank you so much for the important issue that you have raised. I think it concerns all the faculty members who are sitting here. Thank you very much. And I think as Gopal Babuji said, I'm sure the days are going to change because more and more people are going to understand the benefit of this. Thank you very much for
Unless
raising.
and until you make a rule, strict
Yes.
compliance of the
Yes,
norms, regulations, there will not happen anything
Sure,
in
sir.
India. What I see.
Sure, sir. I'm sure this step will be
बातें
taken.
करने से
Thank
कुछ
you
नहीं
very
होता, madam.
Yes,
Thank
yes.
you.
Sure,
Thank you.
sir. We will, I think, move there. Thank you very much for your sharing. Dr. Gopal Babu, thank you so much for the very, very important discussion that you have given. And you have showed way to so many of us sitting here. And you have demonstrated how an institution can actually look so different from all the other regular institutions that we see. Thank you very much. I think this discussion has just started. And I think we have a long way to go. Thank you very much, sir. Thank you very much for the presentation. I would like to now invite the second panelist. We have Dr. Professor V. Sathyanarayanan. He's an Associate Dean, Students Affairs, and Professor of Pharmacology from SRM Medical College, Hospital and Research Center. And he will be talking to us on value-driven health, a new paradigm. I think this is also a very, very interesting aspect.
Thank you, ma'am.
Namaste, sir. He's an MBBS, MD pharmacology, and he has completed many, many courses. I will not read out everything. And he is serving as a university coordinator of value education cell, which is very important at the SRM Medical College, and is a chairperson of UHV committee of SRM Medical College. He has over 30 years of teaching research experience, and he has some very valuable inputs that he can share with us. Welcome, Dr. Sathyanarayanan Garu. The floor is yours.
Thank you.
Sir, just as we have shared with Dr. Gopal Babuji, 20 minutes. I hope we have the 20 minutes.
Yeah,
we'll
sure.
Thank you, sir.
Okay. Is my screen visible?
Yes, sir. It's visible. Yeah.
Okay. So, namaste, everyone. Namaste, dignitaries and delegates. Next slide, please. Today, I'm sharing SRM's journey in reimagining health education, not just as knowledge delivery, but as a value-driven human development. This is about shaping better doctors, healthier individuals, and a more humane healthcare system. So before that, I'll tell about my institution. SRM Institute of Science and Technology is a multidisciplinary university with a strong global footprint. With over 50,000 students and collaborations across the world, SRM believes excellence is not only academic, but also ethical and human-centered. This belief laid the foundation for integrating universal human values into education. Next slide, please. Next slide, please. So I'm working in SRM MHS, that is SRM Medical and Health Sciences, which brings together medical, dental, nursing, pharmacy, and allied health programs. With a 1,500 bed teaching hospital, we train future healthcare professionals in real clinical setting. But we realize something important. skills alone are not enough. Next slide, please. The future of healthcare is not shaped by technology alone. It is shaped by value of the human being using the technology. This thought became our guiding principle. So based on that, value-driven health education, we initiated a new paradigm here. Value-driven health education shifts focus from only treating disease to understanding the human being behind the disease. It connects knowledge with compassion, skill with sensitivity, and science with values. Our aspiration is simple but powerful to nurture healthcare professionals who live values, practice empathy, and heal holistically. When values guide learning, healing becomes natural. So, our aspiration is to build a generation of healthcare professionals who live, learn, and heal through values. What is value driven health? Value driven health is a holistic approach in which health outcomes are shaped not only by medical knowledge and treatment, but by the values that guide mindset, behavior, decision making, relationships, and lifestyle. So, health is not just physical parameters, it is influenced by thoughts, emotions, relationships, lifestyle, and purpose. Value driven health recognizes that inner harmony reflects as outer well being. So, value driven health education integrates self awareness, ethical clarity, emotional balance, social responsibility, and professional competence. It brings together medicine, mind, and meaning. The first integrating force is value education, that is understanding part. Second integrating force is value based education, that is practicing part. Third force is value based living, that is sustaining. And fourth is value driven health, which is transforming. Ultimately, it will create the value driven health force. Next slide. So, why is it needed? We see rising stress, burnout, anxiety, and loss of purpose among students and doctors. Despite advanced training, many feel disconnected from themselves and from patients. This tells us something important is missing. Right? So, because of this, we tried this paradigm shift. Why is it needed again? Healthcare today needs professionals who are not only competent but also calm, confident, compassionate, and value rooted. This is no longer optional, it is essential because this SDG 3 says good health and well being, which aims to ensure healthy lives and promote well being for all people at all ages. The deadline is 2030. So, with this urge in mind, next slide, please. Next slide, please. Our vision is to create a healthcare ecosystem where values guide learning, practice, and living, where well being is sustained, not sacrificed. A health system where values shape behavior, behavior shapes health, and health shapes destiny. This vision leads to healthier habits, harmonious relationships, resilient communities, and ethical and empathetic medical practice. So, when values are internalized, students become resilient, faculty becomes mentors, and institutions become space of growth, not pressure. So, value-driven health education restores balance, meaning, and well-being. So, with this bearing in mind, we moved into this paradigm shift, which is from information to transformation, from stress-driven performance to value-driven excellence, from surviving medical education to thriving in it. It is simply moves from skills to values, from cure to care, from illness to wellness, and from treatment to well-being. So we implemented this vision step by step through knowing, practicing, becoming, and transforming. Each step builds on the previous one. So the first step is value education, which is knowing and understanding. This first step is understanding oneself. Students explore questions like who am I? What do I really want? What makes me happy? So by reflecting and becoming, he will be aware of his self, emotions, motivations. Then understanding comes, core values like empathy, responsibility, integrity, all this will develop. So based on this first step, we formed a dedicated UHV committee Faculty were sensitized through structured programs. UHV was introduced as a well-added course for MBBS students, UHV 1 and 2. The response from students was overwhelming and consistent over years. These are some feedbacks from students. These are not just feedback lines. These are transformational experiences. Students speak about improved relationships, emotional clarity, and inner happiness. This is real education. Students reported that it reduced overthinking, better emotional balance happened, and self-awareness developed. Many said this course helped them during low phases of life. This tells us we are addressing a real need. The step 2 is value-based education, that is practicing. Values must move from classroom to daily action. So we convert them values into skills and habits. Students begin practicing awareness, responsibility, and empathy in academics, hostels, and in clinical postings. So we integrated this into mentor-mentee system. Respectful communication module has been taken. Compassion circles developed. So all this led to learning become experiential, not theoretical. Values started showing in behavior. Step 3 is value-based living, that is becoming. This stage is about habits. Small daily practices create lasting change. Values slowly become a way of life. So what we have done, we introduced well-being touch points, positive peer culture, and mentor check-ins. Hostel life became more structured and supportive. Students felt secure, supported, and stable. So this voice came from the faculty, Dr. K.V. Leela, Vice Principal MHS. According to her own words, this year, 2025, the number of students experiencing exam stress was surprisingly zero. In previous years, the number had been around 10. To find out the reason, I spoke to the students and they attributed it to the UHV course we had started 3 years ago at MHS. I'm encouraged and feel it has to be continued and augmented. This is a powerful outcome. Zero exam stress cases, something unheard of earlier. Faculty clearly saw the impact of UHV over time. This validates the model. Step 4 is value-based health transforming. This step, we are now in this step. So when values stabilize within, health improves naturally, mentally, emotionally, and socially. This is transformation, not intervention. So it forms a healthier community system. So students start living out what they learn. Then reduction in stress happens naturally. Rise in empathy comes, and better decision making for self-health happens. So we are planning holistic well-being clinics, faculty well-being initiatives, and deeper integration with healthcare delivery. The journey continues. And part of the introduction, we introduced this course to dental, pharmacy, and nursing in future, the students. And we already introduced the other courses to medical students, but soon we'll be introducing holistic human health course to the third MBBS students. And finally, at the peak of it, we like to introduce a center for well-being, where not only physical well-being is being given, also mental, emotional, social, and environmental, spiritual well-being will be practiced. So this is our dream for this UHA health. So further plan of action, we are planning to institutionalize this model, expand research, and share it with other institutions. And this is scalable and sustainable. Next slide. So let me give you the roadmap, that is bridging of value-driven health education. So first bridge is between school to first year of MBBS, where the student induction program we teach UHV 1 with IKS 1. Second bridge is made in the second year, where we already we introduced UHV 2, that is foundation course in universal human values. Third bridge will be making it now, that is introducing holistic human health course for the third year. So foundation course in Indian constitution values will be on the fourth year. So these whole bridges will be made along with we make these outreach activities and community health activities parallelly. So what happens is this model bridges education healthcare, and society. It connects values with outcomes and creates professionals who heal beyond prescriptions. So, outcome will be enhanced personal well-being and emotional balance, stronger doctor-patient trust through empathy, integration of values in everyday medical practice, which is a step towards sustainable and humane healthcare. So, healthier students will be there, resilient communities will be there, compassionate caregivers will be there, and a more humane healthcare system will be coming. So, to make this dream real, we have specific commitments for implementing this plan. So leadership commitment is key. Policies, time, space, and support must align with well-being. At SRM, administration actively supports this vision. So we'll be planning that. At the individual level, ultimately values live within individuals. So each student, teacher, and doctor must choose awareness and responsibility. This is where true change happens. So that is the commitment at the individual level. So value-driven health education is SRM's promise for the future. Here, it is not a project, it is a promise to our students, our patients, and society. By integrating compassion with competence, by promoting holistic wellness through education, by inspiring a lifelong commitment to human values and well-being. So we aspire to be a model institution that demonstrates how values transform health education. We welcome collaboration and shared learning. So we dream it as a model institution because already we institutionalized UHV across medical education, leadership, commitment to value-based policies and practices, and we integrated UHV into curriculum, faculty development, and student life, and we have demonstrated impact on student well-being and academic environment. And also we feel a scalable model aligning education, healthcare, and human values. Next slide. So thank you for giving me the opportunity to share our journey. Together, let us build a future where healthcare begins with values. Thank you so much.
Thank you very much, Dr. Sathyanarayan, for the wonderful presentation. I now invite questions from participants. You may please raise your hand and we will provide you with the mic. Yeah, Dr. Prabhujit Kaur Gill, you may please unmute yourself and speak. Yeah.
Good afternoon, ma'am. Good afternoon, sir. Sir, actually, we are also launched the human value ethics for our MBBS students because they are very busy schedule at lot many lectures are there. So we have implemented 15 credit course, at least 15 lectures for first prof and 15 lecture for second, and at the EdCom modules. So you are saying that this is in the third semester, and can you tell me which semester is better for the MBBS students where we can introduce this type of course?
Yeah, that's a good question. So what I feel is, when you start early, you can give them values earlier, it will be better. So best part is, when the students coming from schooling to first year MBBS, foundation course will be conducted as per NMC requirement. In the part of the foundation course, you can include this UHV1. So that will give them a new vision for them to proceed further. Then UHV2 can be given in the second year, part of foundation course during the second year, and third year you can give them as holistic human health, so that it will support the whole system in a better way. I think that is the right time to begin. Thank you.
Okay, sir. Thank you so much.
Thank you very much, Dr. Kaul.
Yes, ma'am.
There's another, Dr. Jagruti. Yeah. Go ahead, Jagruti.
Good afternoon, sir. Good afternoon, Didi. And good afternoon, everyone. Sir, you are running any minority course in your college?
Sorry, any
Minority course of the UHV.
a minority degree, you mean? Yeah, no, we haven't started it yet because it is an university. It is we got engineering side. We have started it, but as a medical side, still the NMC has not given any recommendation on that, and we have tight NMC curriculum, so it will very difficult to introduce that here, but we will try it also if possible. Thank you.
Yes, yes. Thank you, sir.
Thank you very much. Yeah, we have Professor Veenu.
Yes, Professor Veenu. Yeah.
Namaste to all. Sir, am I audible?
Yes, audible.
Sir, namaste. In addition to train your students
Yeah.
To live according to the UHV principles, are you preferring any other mode of medication, in the sense, are you adding Ayurvedic school of thought and other constructive schools of thoughts?
That's a good question, actually. So, but mainstream medicine, as we follow modern medicine, which is a modern medicine, which focuses only on the body-centered approach, but that is not, it is important for emergencies or for infections, antibiotics you can use. Some form of therapy is there for curative therapy, but still majority of the problems are a little bit to explore further. So what we planned is we will be starting a holistic center of well-being where other approaches also can be incorporated, like acupuncture or homeopathy or Ayurvedic system, whatever it is. We take all from them and we can integrate into a center in which it can be, whichever is missing in some system, we can substitute with another system. So like that, we can plan that. So I'll be planning that soon.
So mostly the way in which they live is more important, that you are doing. Thank you very much, sir. Namaste.
Namaste.
Thank you, sir. Any other?
Yeah.
I think we have no questions right now. So thank you very much,
Yes,
Dr. Sathyanarayanan Garu, for the wonderful presentation. I think you gave such important inputs, and I think there's so much to take away, because a doctor's inputs are very, very crucial for each one of us. So you talked about medicine, mind, and meaning. That was quite an interesting chain that you created. So, and this value-driven health education course seems to be of very, very significant importance. And as you said, doctors are themselves facing a lot of burnout and a lot of issues. So it's a very good initiative. And so now what I propose to do is I will invite our guest.
Yeah.
Dr. Amit.
Yeah.
Here with us, sir.
Yes.
I'm sure you would have thoroughly enjoyed the session. So
Yeah.
I would request you to give your observations.
Yeah, I would love to. And am I audible? I hope I am audible.
Yes, sir. Yes, sir.
Okay.
You're
Yeah. Thank you very much, Dr. Geetaji, firstly, for moderating the session so very well, to make each one of us very, very comfortable. Pleasure to be with sharing the platform with Dr. Neetu, my old friend Dr. Gopal Babu. I don't know if he remembers me. I'm happy to see also Dr. Upasna Mishra ji. Then Dr. Thati, I've been in touch with her, and Dr. Sathyanarayan ji. Wonderful everyone. I'm so thankful to you, to the team, to invite me for this very, very close topic, which is very close to my heart. No, value-based culture in academic institutions. How do we build it up? And today we had two sessions from Dr. Gopal Babu and also from Dr. Sathyanarayan. From engineering perspective, from the medical perspective, I think both touch each one of us. let me give my views on both the speakers, the takeaways which I probably got, and then probably I'll share my journey also. No, I always say that I am an engineer turned soldier turned academic leader, with a total journey of around 40 years as on date. And I've seen a lot of ups and downs, both in uniform and also in the academic institutions. Values remain the same, whether it is uniform or the academic fraternity. Now, Dr. Gopal Babu, I must compliment you. I was the director of KIT group of institutions for about 6 years, and I very fondly, very lovingly seen the journey of AKGC, how they became the nodal center. How the human value education has become a kind of a kranti hai. That kranti is there in the AKGC. And now I'm very happy to hear from the presentation. Now they have been nominated as the nodal center by the AICT. Now, I fully agree with Dr. Gopal Babu that the start is easy. There's a lot of josh. Okay, let's do the human values workshops. But then what is important is that continuation. Reaching to the student is very, very difficult. And what I could make out from both the presentations, and I think it is true, that faculty needs to be trained first. And the model of AKGC, I see that there are weekly meetings, there are monthly meetings, and there are annual workshop mandatory attendance by the student, by the faculty members. And I think one of the practice which I started in a KIT group of institution, that unless the faculty attend the human value courses level 1, their probation will not be deemed to be complete. जैसे बच्चों के लिए थोड़ा सा जबरदस्ती करना पड़ता है, the same way probably the leadership has to be a little tough on this. You have to attend the UHV level 1, then only your probation would be regularized. So this is a good way, and this is the only way probably. First and foremost is the faculty members. The faculty members have to be trained. जबरदस्ती उनको train कराना होगा, slowly starting, and then probably it will build up. And as Dr. Gopal Babu mentioned, there will be 3 categories of faculty receptivity. जो एकदम से उसको पकड़ लेंगे, कुछ थोड़ा टाइम लगेगा, कुछ को बहुत टाइम लगेगा. But then that start is very important of building up those 20%. And this is extremely motivating. I think all the institutions must do it. Also, thereafter, the student self-exploration workshops, 5-day student workshop, which has been started in the AKGC. I was not aware that this workshop has been a great success, where the students have been attending Monday to Friday, and then the preceding and the succeeding Saturdays, all about 8 to 10 days. If the students are attending, it means we have won the battle. That is very, very important. And then the students are becoming the counselors. That's even more happy to hear that. And the events like Drishti, the mutually fulfilling communication, all that is fantastic. And another very important thing, I think, which all we must do, that barring the curriculum, the AKTU, for example, in the case of AKGC, they have got human value courses in the first year. After that, it is elective. No, the institutions probably can bind it. I always say that, for example, if we have to build up the soft skills, it can't be done in 1 semester or 2 semesters. It has to be done in the entire journey, all 8 semesters of engineering, or maybe all 10 semesters of medical education. Similarly, the human values, various levels we must have as a compulsory thing. It may or may not be given the credits, or there may be some kind of incentive given to the students, maybe the financial incentive to the students, or some internal marks incentive to the student, so that this journey is not left in between. This continues throughout the academic journey of the students. Maybe only the volunteers, but then this is how it should be done. That the same point was being talked by Dr. Sathyanarayanan, bridges 1 to 4. That's what he mentioned. Also, like to mention, this is the first time I have heard about implementing human values in the health education. The value-driven health education is very, very important. I think more important. And what Dr. Sathyanarayanan mentioned, that it's very, very important that the people should have values who are using the technology. Now, healthcare professionals with values is extremely, extremely important, and more important. Then only you can have a soothing touch to the patients. Very happy to learn that there is a Center for Well-being in the SRM University. A proper center is extremely important. Like in one of my institutions where I served earlier, we created a Center for Happiness. Some name which attracts everyone. The value-based living and ultimately leading to the value-based health. I think these are very, very important milestones for any institution, and maybe in particular for the medical colleges. UHV committee, which Dr. Sathyanarayanan mentioned, is again a very, very important step. And also the UHV buddy club, the student club. That's again a very, very practical thought. So the rules remain the same, what I see. The faculty members, and then the students, and then the continuity of activities. And if we are talking of the same terminology, like in the human value classes, as was mentioned by one of the speakers, then it's very good. If you're using the same terminology while teaching and studying the technical subjects, it means that connect is created, that bond is created. So all this will take time. All this will take time. Now, one of the questions which was asked by one of the professors, I'm sorry, I'm forgetting the name, from Karnataka, he said that it should be made mandatory for the leaders. There should be some regulation that it should be a compulsory part. I think it's very, very important that the top leadership of any institution, maybe see of our country, today we are led by PM Modi ji. So now every organization has become efficient. Government organizations where I served for 30 years, they were known for not being efficient. Today we find that there is so much coming to us from the government organizations like AICT or UGC that is very difficult for the academic leaders like us to handle the mails every day. So everything depends on the leadership. So leadership has to be given the awareness, and I'm aware that the AICT has taken huge steps, big steps. Once the leader is convinced, then the top-down approach, it will work. Like in AKGC, I'm aware that Dr. Agrawal is the man who drove this. It was very close to his heart that we must have human values into the curriculum, and it's very difficult for any institution to spare a faculty member. Any private institution, everything matters there. Each and every penny matters. But then the vision of the leader is even more important. So they could spare few faculty members exclusively to work onto the human values, and that's how this whole culture has developed. Now, I'm very happy to see that two of the institutions, SRM University as well as the AKGC, they become the model institutions in the entire country. AKGC, I'm aware, the culture is really fantastic. And even I'm very happy to hear that the student workshops are a big success. I think all of us, all the institutions, they've got a role model now in front of them that how this thing probably can be implemented in the institution. I also would like to compliment Dr. Gopal Babu when he answered to a question that the senior leadership is not sparing, but then the answer lies in your self-motivation. Like Dr. Gopal said, I started the classes on my own, and some students, they joined me. And when the results start coming, when the students start talking that this is what is the change in their attitude, then the whole environment learns from that. And then there is no choice with the leadership to implement it. So I think we need to take initiative as an individual, and we need to see that this kind of a culture gets into you first. I'll just briefly talk about my journey and how I look the human values into the entire thing. As Dr. Geeta ji mentioned during my introduction, I'm an engineer, and then I joined the defense services, rose to the rank of a colonel, commanded 2 units, and I was very fortunate to participate in the Operation Parakaram and Operation Kargil. And I've seen the value system very, very closely, very, very closely. And I'd like to mention here that the kind of a value system Indian Armed Forces have, that is one of the best value system because the officers, they lead from the front, they take the ownership, and then they move forward. The ownership is, I think, one single biggest trait among the leaders, whether it be in uniform or be it any leader, academic leader or any organization, the ownership, the empathy to your subordinates, to your colleagues, duty and responsibility, trust and teamwork, respect and equality, integrity and truthfulness, courage and compassion, harmony with society, and the sacrifices. These are the traits which I find is there naturally in uniform. Now, I'm reminded of one incident, in the Kargil war, when there was a heavy shelling going on, all of us are aware. And I remember one Sikh regiment soldier, a Khalsa, during the shelling, his arm got cut. It got separated. His left arm, right arm got separated from the shoulder. And just see the kind of a value system the Indian Army has. And there were many other who were injured, who had the bullets and who were about to die. Now, this Sikh gentleman, 6 feet 2 inches, there was a long queue in front of the resident medical officer, we call it RMO. This is in Kargil. Those who are aware, from Srinagar to Leh, there is a route which goes, and on the way there is Kargil. So somewhere that side, there was a regimental medical officer. He was attending to the medical emergencies. And this Khalsa, this Sardarji, he was standing in the queue with his right hand, his left hand holding the right hand. Cut, the right hand was cut from the shoulder, but then उसने अपने left hand से वो अपना हाथ पकड़ के, he was standing in the queue कि जब मेरा नंबर आएगा तब मैं डॉक्टर साहब को दिखाऊंगा, because there are others who are even in a worse situation than this, who's being attended by the doctors. So this is the kind of a value system what has been seen and nurtured in the uniform in the Indian Army. Now, I took a decision of shifting to the academics because I found that the value systems what are there in uniform, they are common to the value system what we need to teach to our children. And for me, it was a very seamless shift, very seamless integration. And I've learned this thing that once you lead any organization, be it academics or be it anything, I think the leaders have to remember 2 things at all levels. One is the coexistence. Everyone has to coexist. And second is you have to have a humble leadership. Leaders have to be humble. Gone are those days where you can have a dictatorial kind of attitude, or you need to lead with example. You need to have a feeling of coexistence, and then the humble leadership at the center of everything, where you are open to the people and they can approach you. They see you as an example. They see you as a person, whom to follow. And all that is possible, to my mind, with only one thing, which the human value has taught to me and to, I think, many leaders, that we must have a harmony with self. I think that is where the whole journey starts. Unless you have a harmony with self, you can't talk of creating a harmony within your class or within your colleagues, within your institution and your family and society and country. We can just forget it. Unless you are at peace with yourself, harmony with yourself, that is where the buck stops. And that is where I think all of us need to look into ourselves first. That's all from my side, and it was a fantastic session. A lot of learnings, and a confidence that some of the institutions are really working very, very hard. Now, let me also tell you that I was the director of Sikkim Manipal Institute of Technology in 2017-18, where there was no talk of human values. And one fine day, we had Dr. Kumar Sambhavji, who visited me there. And we attended that workshop. We conducted that workshop in Sikkim. And that we sowed the seed. And I find that I left that place after 2 years, but then a lot of work was done. And now I think that those seeds have become, into the blooming trees. And similarly, in KIT group of institution, Ghaziabad, we started and the work is going on. So everything depends on the leadership. The leadership is to take the steps forward. And my request to the ICT would be to organize more workshops. And I agree that for the leadership, it should be a compulsory workshop. For them, it should be a compulsory workshop. They should not be promoted to the higher appointments. Maybe all appointments who go to the vice chancellors, for them, there should be a compulsory 8 days workshop. Unless you do this, you will not be getting the vice chancellor appointment. Something like that must be done. And that's how the whole country and the whole culture will transcend into a human value culture. Thank you once again. And thank you once again for inviting me. Namaskar.
Thank you very much, Colonel Garg, for the wonderful observations that you've shared. I agree with you. This was a seamless presentation. It kind of, all the three wonderful people who joined us have built that beautiful garland. Yes. And we have offered it to the society, I think, for the larger benefit. And Dr. Gopal Babu, whom I hear every day in the morning, like Suprabhatam, I love to hear his voice. And Dr. Sathyanarayanan ji, Colonel Garg, thank you so much for sharing such important thoughts. All three of you are technical people, and how beautifully you have presented the aspect where the technical knowledge can be used for the society in such a beautiful way. So with this, I will give it back to our anchor Neetu for closing the session. Thank you very much.
Okay. Thank you, ma'am, for guiding us through this insightful session. And yes, whatever we started with Gopal Babuji, and then Sathyanarayanan sir took us forward with it, and Amit Garg concluded. Yes, it starts from the higher level officials, deans, HODs, and then from the faculty it percolates to the students, and then it becomes a culture of the organization, which reflects in the students. So it was very nice to see all the presentations, all the initiatives that AKGC is taking, and all the initiatives that SRM Medical College is taking. So these institutional sharings, they play a crucial role in enhancing the impact of UHV by enabling the other institutions to learn from the initiatives taken by the ones like AKGC and SRM. And so we can reinforce the value-based learning into all the institutions like this. And now I extend my sincere gratitude to both the presenters, our guest, Dr. Amit, all the panelists, and all the delegates who have joined us from across the globe. I would also like to thank the tech team that we have here. We have Ajay Pal Bhaiya, Bihari Nandanji, Pranab Kumar for making this session go very smoothly and with so much support from the tech team. We will close this session here. Now I request all of you to please stay connected for the upcoming valedictory session, which starts at 2:30. Thank you very much. Namaste to all of you.